Welcome to Lux Scout Psychology. Our minds are incredibly complex. They hold our memories, shape our identities, and guide us. But what happens when the mind encounters overwhelming trauma? This is where dissociative disorders come in. They are a testament to the brain's ability to cope with extreme stress. Imagine your mind as a ship caught in a storm. The mind may fragment itself, creating barriers between thoughts and memories. Dissociation exists on a spectrum. We all experience mild forms of it in our daily lives. In dissociative disorders, these experiences become more intense and disruptive. But with the right support, individuals can heal and reclaim their lives. Dissociative disorders are often misunderstood, misdiagnosed, and stigmatized. Many people, including some healthcare professionals, are unaware of their prevalence and the profound impact they can have on individuals' lives. This lack of awareness often leads to delayed diagnosis and treatment, leaving many struggling in silence. The statistics are startling. It's estimated that millions of people worldwide live with dissociative disorders, with some studies suggesting that the prevalence rates may be even higher than previously thought. Despite their prevalence, these disorders remain shrouded in mystery and misinformation, perpetuating stigma and preventing individuals from seeking help. It's time to break the silence surrounding dissociative disorders. By increasing awareness, we can foster understanding, empathy, and support for those affected by these conditions. We need to equip healthcare professionals with the knowledge and tools to accurately diagnose and treat these disorders, ensuring that individuals receive the care they need. This journey into the world of dissociative disorders aims to shed light on these often hidden conditions. We will explore the different types of dissociative disorders, their causes, symptoms, and available treatments. By understanding these disorders, we can help create a world where individuals feel seen, heard, and empowered to seek help without shame or judgment. Dissociative identity disorder, or DID, is a complex condition with two or more distinct identities within a single individual. These alters have unique characteristics, memories, and even physical mannerisms. Imagine your mind as a house with multiple occupants, each with their own room. Alters may have different names, ages, genders, and voices. Some alters are aware of others, while some remain hidden. Living with DD can be disorienting and isolating. Alters are fragmented aspects of the same person coping with trauma. They often emerge in childhood to protect from trauma. The defining characteristic of DID is dissociative amnesia, gaps in memory too extensive to be explained by ordinary forgetfulness. These gaps can involve entire chunks of time, relationships, and personal experiences. Imagine looking in the mirror and not recognizing the face staring back at you. For individuals with DID, amnesia is often accompanied by depersonalization and derealization. Depersonalization is feeling detached from oneself, while derealization involves detachment from the external world. Symptoms of DID vary widely depending on the number and nature of alters, trauma severity, and coping mechanisms. It's important to note that individuals with DID are not inherently dangerous or violent. The road to understanding and diagnosing dissociative identity disorder, or DID, is often long and arduous. Many individuals with DID suffer in silence for years, their symptoms misattributed to other mental health conditions such as depression, anxiety, or borderline personality disorder. This is due in part to the hidden nature of the disorder, as individuals with DID may be unaware of their alters or may go to great lengths to conceal their symptoms from others. Dr. Smith. Diagnosis requires a comprehensive evaluation by a qualified mental health professional with expertise in dissociative disorders. This evaluation typically involves a thorough clinical interview, psychological testing, and a careful review of the individual's medical and psychiatric history. The process of diagnosis can be challenging, as the symptoms of DID can overlap with other disorders, and individuals may be reluctant to disclose their experiences due to fear of judgment or disbelief. It's crucial to remember that DID is a real and debilitating disorder, not a fad or a figment of the imagination. Individuals with DID deserve compassion, understanding, and access to appropriate treatment. Stigma and misinformation only serve to perpetuate suffering and prevent individuals from seeking the help they need. In the next section, we will delve into the world of dissociative amnesia, exploring the different types of memory loss that can occur in dissociative disorders and their profound impact on individuals' lives. Memory weaves the tapestry of our lives, connecting past to present. But what happens when that thread is severed, leaving blank spaces? This is the reality for those with dissociative amnesia, unable to recall important personal information. Imagine waking up in a strange city with no memory of how you got there. The past becomes a hazy, inaccessible realm, shrouded in fog. The mind draws a veil over painful experiences, rendering them inaccessible. These gaps create a fragmented sense of self, deeply unsettling and isolating. Dissociative amnesia manifests in different ways, depending on the nature and extent of the memory loss. Some experience localized amnesia, with gaps around traumatic events. Others have selective amnesia, recalling some but not all aspects of an event. In extreme cases, generalized amnesia erases entire life histories. This profound loss of identity can be utterly disorienting. Dissociative amnesia highlights the mind's ability to protect from unbearable pain.
Living with dissociative amnesia is like navigating a labyrinth of lost time, where familiar paths lead to dead ends. The inability to access significant portions of one's past can create a profound sense of fragmentation.
The impact extends far beyond the individual, affecting relationships and overall well-being. Healing requires patience, compassion, and skilled guidance. With the right support, individuals can reclaim lost time and emerge with a renewed sense of self. Imagine this. You wake up one morning, but something feels profoundly off. You're in an unfamiliar bed, in a strange room, with no recollection of how you got there. As you look around, a chilling realization washes over you. You don't recognize yourself in the mirror. This is the stark reality for individuals experiencing dissociative fugue, a rare condition characterized by sudden, unexpected travel or wandering. They may travel miles from home, assuming new identities, unaware of their past lives. It's as if their own existence has become a mystery. The duration can vary, lasting for hours, days, weeks, or even months. During this time, they may appear outwardly normal, forming new relationships. The triggers are varied, from severe stress to traumatic events. The fugue state becomes a coping mechanism, a way to hit pause on reality. Life in a fugue state is a peculiar paradox, a tapestry woven from threads of both normalcy and amnesia. They function well, holding jobs and forming relationships, while a profound sense of detachment simmers beneath the surface. For some, the fugue state provides a temporary reprieve from overwhelming stress and trauma. However, this respite is often short-lived, as underlying psychological distress threatens to shatter their new reality.
The emergence from a fugue state can be sudden and disorienting. It's as if the curtain falls, thrusting them back into their former lives with little recollection.
And family therapy can also play a crucial role in the recovery process, providing a safe space for loved ones to express their feelings, repair strained relationships, and develop strategies for supporting the individual's ongoing healing. Open communication, understanding, and empathy are essential for rebuilding trust and fostering a sense of stability and security in the aftermath of such a disorienting experience. Dr. Smith, while dissociative fugue is a rare and often bewildering condition, it's important to remember that recovery is possible. With the right support, individuals can navigate the complex emotions associated with their experience, develop healthier coping mechanisms, and ultimately, reclaim their lives and identities, emerging from the shadows of fugue with a newfound appreciation for the precious and fragile nature of memory and self. Imagine feeling like you're watching yourself from outside your body, as if you're an actor in a movie of your own life. Your reflection in the mirror seems unfamiliar, your voice sounds distant, and your own thoughts and feelings feel foreign. This unsettling experience is the hallmark of depersonalization, leaving individuals feeling like strangers in their own bodies. Depersonalization-derealization disorder involves persistent or recurrent episodes of detachment from oneself or the world. Depersonalization is detachment from oneself, while derealization is a feeling of unreality from the external world. Derealization casts the external world in an unsettling, dreamlike hue. Objects may appear distorted in shape, size, or color. Distances seem skewed, and familiar environments take on an eerie, unfamiliar quality. It's as if the world has become a stage set, and the individual is merely a detached observer. Imagine walking down a familiar street, yet feeling like you're seeing it for the first time. The buildings seem to tilt, the colors appear washed out, and the sounds are muffled. This sensory distortion and detachment is a hallmark of derealization. The experience can be incredibly isolating as individuals struggle with their distorted perceptions. This dissonance can lead to anxiety, confusion, and a sense of being trapped in a waking dream. Living with depersonalization-derealization disorder is like navigating a world that constantly shifts between clarity and distortion, connection and detachment. It's a daily struggle to reconcile the subjective experience of disconnection with the objective reality of one's existence, a challenge that can impact relationships, work, and overall well-being. Individuals with this disorder often struggle to describe their experiences to others, fearing that their words won't adequately convey the profound sense of detachment and unreality they feel. This difficulty in articulating their internal experience can lead to feelings of isolation, as loved ones may struggle to understand and provide the support they need. The good news is that depersonalization-derealization disorder is treatable. With the right support and therapeutic interventions, individuals can learn to manage their symptoms, reduce the frequency and intensity of their episodes, and regain a sense of grounding and connection with themselves and the world around them. Therapy for depersonalization-derealization disorder typically focuses on addressing the underlying trauma or stress that may be contributing to the disorder, as well as developing coping mechanisms for managing anxiety and grounding oneself in the present moment. Techniques such as mindfulness, deep breathing exercises, and sensory grounding techniques can be helpful in reducing the sense of detachment and restoring a sense of connection to the here and now. To truly understand dissociative disorders, we must explore their origins, where trauma and unprocessed stress reside. Research shows a strong link between childhood trauma and dissociative symptoms. Imagine a young mind, still learning to navigate the world, suddenly overwhelmed, shattering its sense of safety. This is the impact of trauma, especially in childhood, leading to dissociation as a coping mechanism. The mind fragments to protect itself, creating barriers between thoughts, feelings, and memories. Research suggests genetics may play a role in susceptibility to dissociative disorders. Individuals with a family history may be at increased risk. Genetic predisposition means vulnerability to environmental triggers. Researchers explore neurobiological factors in dissociative disorders. Differences in brain structure and function are noted. Psychological factors also contribute to vulnerability. Understanding these influences aids in developing effective treatments. Diagnosing dissociative disorders is a delicate process of unraveling hidden pain and piecing together a fractured self. These disorders can masquerade as other mental health conditions, making diagnosis complex and lengthy. The first step often begins with recognizing the need for professional help. Many may not understand their experiences or feel shame in disclosing symptoms. It's like carrying a heavy burden in silence. A thorough evaluation by a qualified mental health professional is paramount. This involves a comprehensive clinical interview and exploring current symptoms in depth. It's about listening with empathy and creating a safe space for sharing. The goal is to guide individuals toward a more integrated and fulfilling life. Embarking on the path of healing from dissociative disorders is a deeply personal journey, requiring courage, resilience, and skilled support. A multifaceted strategy is essential for lasting recovery. Psychotherapy, especially trauma-focused therapies, forms the cornerstone of treatment. These therapies provide a safe space to explore trauma, process experiences, and develop healthier coping mechanisms. It's about reclaiming fragmented memories and integrating identities. CBT helps identify and challenge negative thought patterns. By reframing thoughts, individuals develop more adaptive behaviors. DBT teaches skills for managing intense emotions and healthier relationships. Learning to regulate emotions and communicate needs effectively. The goal is to reclaim a sense of self and build an authentic life. These strategies, often tailored to the individual's unique needs and preferences, provide a framework for managing stress, regulating emotions, and cultivating a sense of safety and stability in their lives. Support group leader group therapy can be an invaluable resource, providing a supportive and understanding community where individuals can connect with others who share similar experiences, share their stories, and learn from one another's journeys. This sense of shared experience can help to reduce feelings of isolation, shame, and stigma, fostering a sense of hope and empowerment. Support group leader. Creative therapies, such as art therapy, music therapy, and movement therapy, offer alternative avenues for expression, allowing individuals to tap into their creativity, process their emotions nonverbally, and foster a sense of self-discovery. These therapies can be particularly helpful for individuals who struggle to articulate their experiences verbally, providing a safe and expressive outlet for their emotions. Support group leader. Lifestyle changes, while seemingly small, can have a profound impact on overall well-being, reducing stress, improving sleep, and promoting emotional regulation. Regular exercise, a balanced diet, mindfulness practices such as meditation, and engaging in enjoyable activities can all contribute to a sense of grounding, balance, and well-being, creating a solid foundation for healing and growth. Embracing recovery. Recovery from dissociative disorders is a winding road with twists, turns, and setbacks. Recovery is attainable with the right support, commitment, and self-compassion. Early intervention and consistent treatment help reclaim lives and relationships. Navigating the world with awareness and resilience cultivates hope for a brighter future. Recovery involves a supportive network of professionals, loved ones, and community resources. Fostering understanding and reducing stigma empowers individuals to seek help. Dissociative disorders are stories of resilience and the mind's capacity to survive adversity. Shedding light on these experiences fosters empathy and paves the way for recovery. Our journey into the intricate world of dissociative disorders has revealed the profound impact these conditions can have on individuals' lives, their sense of self, and their relationships with the world around them. We've explored the depths of dissociative identity disorder, where multiple identities coexist within a single mind, each a testament to the brain's remarkable ability to compartmentalize and protect itself from overwhelming trauma. We've navigated the disorienting labyrinth of dissociative amnesia, where memories, once vivid and clear, fade like whispers in the wind, leaving behind gaps and fragments in the tapestry of personal history. We've witnessed the bewildering flight from reality in dissociative fugue, where individuals embark on amnesia-driven journeys, their true identities veiled in a fog of forgetting. And we've delved into the unsettling realm of depersonalization-derealization disorder, where the boundaries between self and other, between reality and unreality, blur and distort, leaving individuals feeling like strangers in their own bodies, adrift in a world that seems both familiar and profoundly alien. Throughout our exploration, one resounding truth has emerged. Dissociative disorders are not signs of weakness, but rather testaments to the human mind's incredible capacity for adaptation and survival in the face of unimaginable adversity. They are cries for help, whispers of pain that deserve to be heard, understood, and met with compassion and support. A call to awareness and understanding. Recovery is possible with the right support. Early intervention and trauma-focused therapies are crucial. We must create a world of understanding and empathy. Together, we can transform trauma into resilience. Please like the video and share it with others. It helps those who are suffering. Thank you for watching.